Hi, I'm Dr. Shankar Kumar. I'm going to talk in the next 5 to 7 minutes about the fine needle aspiration of thyroid. Thyroid gland is a butterfly-shaped gland that is present in the middle of the neck. I'm going to talk about what is thyroid nodule, who are at risk to develop a thyroid nodule, what are the indications to do a fine needle aspiration. I'm going to talk about the procedure, and I'm also going to talk about some of the few complications, and finally the reporting of fine needle aspiration with the slides. You can see the thyroid gland, which is a butterfly-shaped gland in the middle of the neck, and the nodule can be present on this gland. It's a growth within the thyroid gland. They're extremely common and can be seen in 5 to 10% of women and 1 to 5% of men. So what are the risk factors to develop a thyroid cancer? A positive family history of thyroid cancer, a family history of syndromes, cancer syndromes, exposure to radiation to head, neck or upper chest, age less than 20 years or more than 70 years, a male gender, nodules that are increasing in size, nodules that have hard consistency, enlarged lymph nodes, and hoarseness of voice. All these things can predispose to the development of thyroid cancer. Fine needle biopsy is the most accurate test for evaluating the thyroid nodules. The biopsy may be performed under ultrasound guidance. This is the only non-surgical method of determining whether the thyroid nodule is benign or malignant. What are the indications for the fine needle aspiration is any thyroid swelling with a suspicion of benign or malignant condition of the thyroid gland is a definite indication for an FNAC. What is a fine needle aspiration? It is a simple procedure similar to drawing blood from your arm. The needle used is thinner than the one drawing the blood. It is attached to a syringe with a syringe holder that allows the operator to apply suction easily. Cells from the thyroid lesion will be extracted through this needle by aspiration. These cells are smeared, spread on a glass slide, strained, and then made ready for examination under the microscope. After examining the sites, the pathologist will determine and give the cytological diagnosis in a written statement. So coming to the procedure of the fine needle aspiration of a thyroid nodule is, preferably the patients who are undergoing this fine needle aspiration should avoid the blood thinners like clopidogrel or aspirin 1 to 2 days prior to the procedure because of the risk of bleeding. Make the patient to lie on the back with a pillow placed under the shoulders to extend the neck so that you get a clear visibility. Clean the site of the biopsy with antiseptic solution or spirit. Feel the nodule. If you have an ultrasound guidance, you can localize the nodule and insert a thin hollow needle into the nodule, either clinically or using ultrasound imaging to see that the needle is on target. Extract a sample of the cells from the nodule into the needle, which is withdrawn after 5 to 13 seconds at 2 to 3 sites. Apply pressure after the biopsy site, after collecting adequate. This is a patient who had a thyroid swelling, adenoma, was being examined and is undergoing an FNAC in our setup. You can see the procedure that is being done. The nodule is felt and the needle is about to be inserted into the nodule. The possible complications following a fine needle aspiration could be a minor bleeding, bruising over the needle where it's inserted. Pain can be felt after the procedure and a remote possibility of infection which has to be taken care and treated with antibiotics. Conditions that are diagnosed by fine needle aspiration are benign conditions like nodular colloid goiter, follicular adenoma, subacute thyroiditis, and Hashimoto's thyroiditis. The malignant conditions are follicular carcinoma, papillary carcinoma, undifferentiated carcinoma, and lymphoma. The pathologist will report the thyroid fine needle as a benign condition, a malignant condition, indeterminate, or inadequate. A benign is a non-cancerous situation, will not need any surgery. A malignant is a cancerous report or a suspicion of malignancy and needs further management plan. A nodule is indeterminate, which is not very sure, something like Hürthle cell neoplasm and atypical lesions. The biopsy is called inadequate or non-diagnostic if they aspirate only a fluid or a blood.